Hello, my name is Sivaram and this is my presentation on Gall Bladder Cancer for Genetik Manusia Perubatan STBG on 3 under guidance of Prof. Endom with Ismail. Well, gallbladder cancer is basically a rare disease in which the malignant cancer cells are found in the tissues of gallbladder. The gallbladder is a pear-shaped organ that lies just under the liver in the upper abdomen. The gallbladder stores bile, a fluid made by the liver to digest fat. When the food is being broken down in the stomach and intestines, bile is released from the gallbladder through a tube called the common bile duct, which connects the gallbladder and the liver to the first part of the small intestine. Well, as much as for the symptoms and the issues, there are no symptoms in the early stages because they are too nominal to be discovered, and the fact that they are hidden behind the liver, which is small, makes it even harder for the early detection. And even though one may remove the gallbladder, they are still subjected to the risk of getting a gallbladder cancer. The symptoms are jaundice, yellow skin, pain above stomach, bloating, or lumps in the abdomen, which are pretty much very similar to any liver-related diseases. Even though the identification tests are difficult, there are several tests that we may use to identify this disease, which includes the liver function test, blood chemistry test, CAT scan test, ultrasound test, MRI, endoscopic ultrasound, or even the laparoscopic and biopsy, of which there are two specialized identification tests that we may use, which are the percutaneous transhepatic cholangiography and the endoscopic retrograde cholangiopancreatography, whereby the percutaneous transhepatic cholangiography involves the insertion of probe through a small hole made under the rib, where the endoscopic retrograde, suggested from the name itself, involves the insertion of probe through the mouth. Cause and risk. It's not clear what causes the gallbladder cancer. The gallbladder cancer forms when healthy gallbladder cells develop changes or mutation in the DNA. Most gallbladder cancers begin in the glandular cells that line the inner surface of the gallbladder. The gallbladder cancer that begins in this type of cell is called adenocarcinoma, which refers to the way the cancer cells appear when examined under the microscope. And as much for the risk, gallbladder cancer is more common in women at older age. In fact, two-thirds of the cases and deaths occurred among women. And a history of gallstone. Even though a person in this condition may still have a risk to gallbladder cancer, it's still rare. And other gallbladder conditions that can increase the risk of gallbladder cancer includes the polyps, chronic inflammation, and infection. Primary sclerosing cholangitis, which causes the inflammation of the ducts that drain the bile from the gallbladder and liver, increases the risk of the gallbladder cancer. There are basically five stages of the cancer in the gallbladder cancer, which includes the stage 0 of the carcinoma in situ, stage 1, 2, 3, and 4. The cancer may be treated according to the localization, whereby the stage 1 is localized and unresectable, recurrent, or metastatic involves the stage 2 and stage 3 and stage 4, and the cancer spreading methods, which include tissue, lymph system, and blood. The stages in details, whereby the stage 0 involves the abnormal cancer are found in the mucosa or the innermost layer of the gallbladder wall, which spread to the muscle layer of gallbladder wall in the stage 1 and followed by the spreading to the on the side of the gallbladder that's not near the liver and on the side that's near the liver, which is the stage 2, whereby the cancer has still not spread to the liver. But in stage 3A, the cancer has spread to the serosal layer that covers the gallbladder and liver as well as nearby organ. Stage 3B, the cancer is formed in the mucosa of the innermost layer in the cell wall and spread to nearby lymph nodes. And the final stage, which involves the stage 4A, the cancer spread to the portal vein or hepatic artery or two or more organs nearby the liver. In stage 4, the final process, the cancer has spread to nearby organs, structures, lymph nodes, and peritoneum. There are several treatments to treat this cancer, of which mainly involves the cholecystectomy, a surgery to remove the gallbladder and some tissue around it, whereby a probe, laparoscope, is inserted to guide the gallbladder surgery by attaching or inserting the incision port in the abdomen, as described by the image shown. And not just the main surgery itself, there's some palliative surgery that may relieve the symptoms, which is involve the biliary bypass or endoscopic stent placement or even percutaneous transhepatic biliary drainage. These are some of the palliative surgery that may relieve the symptoms, as shown in the image above. Interestingly, more recently, there are some treatments that are revolutionized the gallbladder cancer treatment, which involves the radiation sensitizers, targeted therapy, or immunotherapy. Where the radiation sensitizer involves a hyperthermic therapy and radiation sensitizers, target therapy uses drugs or substances that identify and attack certain cancer cells, which involves the main drug of ivosidenib. which works by blocking a specific mutation in a gene called IDH1. And immunotherapy involves the patient's immune system to fight the cancers, whereby the substances are made by the body or made in the laboratory to use to boost, direct, restore the body's natural defenses against cancer, such as the PD-1 inhibitor. Regarding all the references used to make this presentation, which come from the NCBI, it may be found in the QR code shown above. And that's it. Thank you, Genetics for Future for Better Life. Thank you very much.